A cervical disc disorder. Before we start coding M50 category, let's quickly understand the cervical spine anatomy. The cervical spine, which forms the neck region, contains 7 vertebrae from the C1 to C7. Between these vertebrae are the intervertebral disc that acts as a shock absorber and helps neck move smoothly. The most commonly affected disc level are the C5, C6 and C6, C7 because these level experience the greatest movement and stress. For the easy understanding, cervical disc level can be divided into the three regions. In that, high cervical C2, C3 and C3, C4. Mid cervical is a C4, C5 and C5, C6, and lower cervical is a C6, C7 and C7, T1. As a coder, it is important to identify the disk level documented by a provider because this level can affect the code selection and helps to understand the clinical condition more quickly. Next is a type of cervical disc disorder. When this disc become damaged, different condition can occur. First one is a myelopathy. Myelopathy means the disc is compressing the spinal cord and patient may have a difficulty walking, weakness, balance problem like that. For the cervical disc disorder with myelopathy, we look into the category M50.0. Next is a radiculopathy. Radiculopathy means the disc is pressing on a nerve root. Symptoms include like neck pain radiating to the arm, numbness, tingling, and weakness. For the cervical disc disorder with the radiculopathy, we use category M50.1. Suppose the patient has a cervical disc disorder with the radiculopathy and also the radiculopathy of cervicothoracic region. In that case, we can code both M50.1 and M45.13 because it's exclude 2 under the M50.1 category. Next is a disc herniation displacement. This occurs when the disc bulges or pushes out from its normal position and may compress a nearby nerve. For the cervical disc displacement or herniation, we use the M50.2 category. Next is a degeneration or degenerative disc disease or DDD. In that, over time, disc wears down due to the aging and daily stress. This is called a degenerative disc disease or DDD. For the cervical degenerative disc disease, we use category M50.3. Next is a M50.8 for other cervical disc disorder, and if unspecified cervical disc disorder, at that time we code M50.9. One important coding tip here is if the patient has a disc disorder at more than one region, code the highest level of each region. Thank you.